Hello friends, welcome to Shri Netralaya. Implanting a 3-piece foldable sensor IOL is always a challenge for most of the surgeons. The size of incision required is slightly more, the rigidity of IOL is high, and if polyamide haptics get kinked, the IOL will get decentered and tilted, which will give coma, aberrations and induced astigmatism due to IOL decentration. So how to implant this beautiful IOL, and I will also show you the technique to implant this particular IOL through a single piece Johnson & Johnson 2.8 cartridge. Here note I have pulled the optics slightly behind so that I will have both the optics good visible and optics will have enough space to be in the groove of cartridge without getting a C-loop. J&J is having a butterfly cartridge for injection of 3-piece IOL, which I feel is too large and difficult to implant. I will show you both the techniques. Here we will go with the routine technique suggested by the company. So let's see this once more. Here I am extending my incision to 3 mm at least. Remember, the cartridge is not wound assisted, so the tip of cartridge should go inside the AC to implant this particular IOL. The injector I am using here is a screw type metallic injector. Once the tip of the cartridge is inside the anterior chamber, you have to rotate the screw from behind so that IOL will get pushed into the anterior chamber. While doing so, you have to rotate your hand slightly towards right so that IOL optic will get a proper direction to be implanted in the bag as shown in the video. As this is a screw type injector, left hand will be engaged and that cannot be utilized to direct the optic in the capsular bag, so you have to manage it with rotation of the hand. Once your leading haptic is in the bag and the optic is in the AC, just push the IOL to the maximum and get rid of your injector system. Trailing optic will be behind and will be out through the incision. At this point, inject a viscoelastic in the anterior chamber, form the anterior chamber nicely and then slowly dial the trailing haptic in the bag with the help of dialer. With this, the IOL is in the bag. To confirm IOL implantation fully in the bag with both optics in the bag, you can rotate the IOL. The smooth rotation of the IOL and seeing the complete 360-degree CCC margin indicates that IOL is fully in the bag. It may be slightly challenging and necessary to confirm IOL implantation in the bag in cases of small pupils. So I suggest to rotate this particular IOL and make sure that you are fully in the bag. Now again, coming back to loading of this IOL, I will show you one more video showing a loading of this particular IOL in the cartridge. The temperature of environment and the temperature of IOL matters for this particular IOL, as the material gets more stiff at colder temperature. I usually switch off my AC 10 minutes before and do the surgery. I usually keep this IOL out of the operation theatre in a normal temperature before implantation, because at colder temperatures the IOL gets more stiff and difficult to manipulate and implant. Both the prongs of the cartridge are well open. The IOL is kept in a groove in a straight way so that there is no tilting of the IOL haptic while closing the flanges of the cartridge. Have copious amount of viscoelastic in the groove of cartridge before implantation of this IOL. Make sure both the optics, unlike foldable IOL which has to be folded, here they should be opened and should not form a C loop, as these polyamide haptics have a very good memory. The trailing haptic has to come out of the cartridge, and it should be like that while loading in the cartridge. Once you have loaded the cartridge, check it under the microscope to make sure optic is well in the groove and both the haptics are in position without having a C loop. Now you can load this cartridge into the plunger and carefully engage the plunger with the optic of IOL without getting your haptic into it. It is very important that your trailing haptic should be lying behind and it should not be engaged in your plunger. Once you are done with this, you can push the IOL optic further, and through the window of this metallic cartridge you can note the optic and haptic positions while pushing the IOL, just to make sure that everything is done well. Again, increase the incision size to at least 3 mm. This is not a wound assisted delivery, so you have to enter into the anterior chamber and rotate the hand so that optic gets in a proper position and in the back, and the trailing haptic should not be tried to push in the same go. Now you have understood how to implant this particular IOL with the company provided cartridge. I find it slightly more challenging, increasing the incision size too much and leading to the amount of astigmatism. So I worked out some other methods and I have implanted this particular IOL through a single piece 2.8 Johnson & Johnson cartridge. Let's see how to achieve it. Again, I am having a sensor 3-piece IOL. I have washed IOL with saline and applied some amount of viscoelastic over the optic of IOL. In my left hand, I am holding a 2.8 cartridge from J&J, and with the right hand, I am loading this IOL in the single piece cartridge. Please note how I am loading the leading haptic of this IOL so that it should not form a C loop. Once the leading haptic is in proper position in the cartridge, you can go with the optic. The optic has to be pushed slightly and not too far with the straight forceps as in a single piece IOL, as that will be difficult to manipulate later. Once your optic is in and well folded, trailing haptic will be behind and should not form a C loop. Now you can load this cartridge into the injector system. You can observe the cartridge under the microscope and note that your leading haptic is straight and trailing haptic is straight. Here I have locked the cartridge into the injector and I will push the plunger slightly, and here you note, as soon as I push my plunger, the trailing haptic is getting engaged in the plunger. Now to avoid this, use the Sinskey hook and go in and hold the trailing haptic behind with the help of Sinskey hook. Do not allow the trailing haptic to engage into the plunger so that any kinking will be avoided, and the plunger should reach to the level of optic and your trailing haptic should be lying freely behind. Now you can push the optic slightly in front with the help of plunger, and note the optics are well in position, which can be very well observed under the microscope. Now coming to implantation of this IOL in the bag. Again, I will suggest a minimum incision size of 2.8 millimeters. Here the advantage you are getting is you can manipulate with your left hand the optic, and the optic can be held with the help of Sinski hook in the left hand, and it can be directed in the bag and in a folded fashion so that it should not injure the posterior capsule. Also, a slight right-sided rotational movement helps to make the IOL in a proper position while implanting it in the eye. And this way you can direct your leading haptic in the bag and a optic in the anterior chamber, leaving the trailing haptic behind to follow through the incision. Here you have a very less space between a plunger and a cartridge, so your trailing haptic may get caught in the cartridge. Try to push and pull this plunger slightly so that in 1 or 2 attempts it will get released. Do not try to hurry at this stage. Once you are done with your injector, remove the injector. Now you have a leading haptic in the bag, optic in the anterior chamber, and a trailing haptic through the incision. Form the anterior chamber and dial the IOL trailing haptic into the bag. The smooth rotation of IOL in the bag indicates that it is fully in the capsular bag. With this modification, I am easily implanting my 3-piece sensor IOLs in the bag without any issues, and I hope this particular modification will help you a lot in your clinical practice. Thank you and good day.